Greetings, fellow humans. Katrina here. Quick disclaimer, I'm a professional, not your professional. Nothing I'm about to say should be taken as medical legal advice. This podcast is purely for education and amusement. That is it. Disclaimer over. So today I thought I'd talk about what I don't know about nature. I like drawing stuff from the school system, and so Yale has an education page where there's some information on eco-psychology. So I thought I would share today a bit by Jim Robbins, written January 9th of 2020, on eco-psychology, how immersion in nature benefits your health. I don't really know all the science behind how nature benefits the health, but we're going to get into a little bit of it. So a growing body of research points to the beneficial effects that exposure to natural world has on health, reducing stress, and promoting healing. Now, policymakers, employers, and healthcare providers are increasingly considering the human need for nature in how they plan and operate. So, how long does it take to get a dose of nature high enough to make people say they feel healthy and have a strong sense of well-being? Precisely 120 minutes. So, in a study of 20,000 people, a team led by Matthew White of the European Centre for Environment and Human Health at the University of Exeter found that people who spent 2 hours a week in green spaces, local parks, or other natural environments, either all at once or spaced over several visits, were substantially more likely to report good health and psychological well-being than those who don't. 2 hours was a hard boundary. The study, published last June, showed there were no benefits for people who didn't meet that threshold. So 115 minutes isn't enough, 120. The effects were robust, cutting across different occupations, ethnic groups, people from rich and poor areas, and people with chronic illnesses and disabilities. It's well known that getting outdoors in nature can be good for people's health and well-being, but until now, we've not been able to say how much is enough, White said. 2 hours a week is hopefully a realistic target for many people, especially given that it can be spread over an entire week to get the benefit. The study by White and his colleagues is only the latest in a rapidly expanding area of research that finds nature has robust effects on people's health, physically, mentally, and emotionally. So the studies point in one direction. Nature is not only nice to have, but it's a have to have for physical health and cognitive function. There's a quote here. It says, "When I wrote Last Child in the Woods in 2005, this wasn't a hot topic," said Richard Love, a journalist in San Diego whose book is largely credited with triggering this movement and who coined the term nature deficient disorder. This subject was virtually ignored by the academic world. I could find 60 studies that were good studies. Now it's approaching and about to pass 1,000 studies, and they point in one direction. Nature is not only nice to have, but it's a have to have for physical health and cognitive functioning. Oh, they did that quote twice. So these studies have shown that time in nature, as long as people feel safe, is an antidote for stress. It can lower blood pressure and stress hormone levels, reduce nervous system arousal, enhance immune system function, increase self-esteem, reduce anxiety, and improve mood. Attention deficit disorder and aggression lessen in natural environments, which also helps speed the rate of healing. In a recent study, psychiatric unit researchers found that being in nature reduced feelings of isolation, promoted calm, and lifted mood among patients. A growing body of research combined with an intuitive understanding that nature is vital and increased concerns about the exploding use of smartphones and other forms of technology has led to a tipping point at which health experts, researchers, and government officials are now proposing widespread changes aimed at bringing nature into people's everyday lives. For example, researchers and policymakers now talk about park deserts in urban areas. Cities are adding or enhancing parks, and schools and other institutions are being designed with large windows and access to trees and green space, or blue space, as in aquatic environments. businesses are increasingly aware of the desire among employees for access to green spaces. It's needed to attract a skilled workforce, said Florence Williams, who's the author of The Nature Fix. Young people are demanding high-quality outdoor experiences. The number of forest schools, which have long been a tradition in Scandinavia, where much of the learning takes place in natural settings in the outdoors, have mushroomed in the United States, up by 500% since 2012, according to Love. Oregon recently passed a ballot measure to raise money for outdoor schools, and the state of Washington just became the first state to license outdoor preschools, where much of the play and learning occurs outside. The organization Children and Nature Network, founded by Love and others, advocates for more time in nature for children, tracks the research, and has a long list of abstracts that summarize studies on the subject on its website. And the Trust for Public Lands, or TPL, has just finished a 7-year project to map the parks of the U.S. with the aim of identifying places in need of parkland. We've mapped 14,000 communities, 86% of the nation, and looked at who does and who doesn't live within a 10-minute walk of a park, said Adrian Benep, a senior advisor of TPL. The organization has a 10-minute walk campaign to work with mayors across the U.S. to make sure all people have that kind of access. An increasing number of healthcare providers are also embracing the back to nature paradigm. One organization, ParkRx America, founded by Robert Czar of University Healthcare of Washington, D.C., declares its mission, quote, to decrease the burden of chronic disease, increase health and happiness, and foster environmental stewardship by virtue of prescribing nature during routine delivery of healthcare by a diverse group of healthcare professionals. The organization has 10,000 parks in its prescribing platform. The Global Association and Forest Therapy Guides shows clients how to use immersion in nature for healing. The forest is the therapist, the group slogan reads. The guides open the door. Studies show that the effects of nature may go deeper than providing a sense of well-being, helping to reduce crime and aggression. In 2015, a study of 2,000 people in the United Kingdom found that more exposure to nature translated into more community cohesion and substantially lower crime rates. And while more vegetation is thought to encourage crime by providing security for criminals, another study found the opposite. Vegetation abundance is associated with a reduction in assault, robbery, and burglary, although not theft. Still, many of these studies are correlational rather than causal. That means it is hard to show that natural landscapes cause these effects, though these things happen when people are in a natural environment. Sarah L. Warber, professor of family medicine in the University of Michigan, noted that there are no, quote, randomized controlled studies, end quote, on the effects of nature on human health. Nonetheless, she said, there are epidemiological studies and measurements of before and after exposure to nature, and the results from this research are robust. Peter H. Kahn, a professor of psychology at the University of Washington, who has worked on these issues for decades, is encouraged by the new focus on the subject, but concerned that the growing interest is more contact with nature, relies too much only on experiencing it visually. That's important, but an impoverished view of what it means to interact with the natural world, he said. We need to deepen the forms of interaction with nature and make it more immersive. What are the active ingredients in a dose of nature? Pioneers in this work, Rachel and Stephen Kaplan, who began studying the subject in the 1970s, devised attention restoration theory, which holds that paying attention in bustling cities at work or in other stressful environments requires a good deal of effortful attention. In a natural environment, however, Kaplan's found that people paid more attention more broadly in a less effortful way, which leads to far more relaxed body and mind. Japanese researchers have studied forest bathing, a poetic name for walking in the woods. They suspect aerosols from the forest inhaled during a walk are behind elevated levels of natural killer or NK cells in the immune system, which fight tumors and infections. A subsequent study in which essential oils from cedars were emitted in a hotel room where people slept also caused significant spike in NK cells. However, this growing field may be defined it is gaining momentum. Um, in a recent paper, 26 authors laid out a framework to create a formal rule for the positive impacts nature has on mental health and to formulate a model for conserving nature in cities and integrating it into planning for those health effects. We have entered the urban century, with 2/3 of humanity projected to be living in cities by 2050, said Gretchen Daly, director of Natural Capital Project at Stanford University and senior author of a recent paper arguing that the cognitive and emotional benefits of nature should be factored into the economic ecosystem service models. There is an awakening underway today to many of the values of nature and the risks and costs of its loss. This new work can help inform investments in livability and sustainability of the world's cities. While research has grown leaps and bounds, Kahn and others argue in a recent review paper that research into the topic is still lacking in many ways, and they lay out a research agenda that they say would help formalize the role of nature in a public health policy. So understanding nature's therapeutic effects may be arriving at a propitious moment. I can't say that word, but it's a interesting moment. Some studies have found that anxiety over climate change is a growing phenomenon. Ironically, one of the best antidotes for that might be a dose of green space. If I'm feeling depressed and anxious and worried about the environment, Warber said, then one of the best things I can do is go out in nature. So I hope you all enjoyed today's episode. If you have any desire to contribute to me, you can click the button on the website. And remember, I appreciate each and every one of you simply for existing.